Hi, everybody. This is Dr. Danesh, and
This is Dr. James Escaloni.
we are starting off the new and improved 50 Shades of Pain show with myself and Dr. Escaloni.
hmm
So, give me 1 second because doing we are actually doing this in two forms, two media. So, Dr. Escaloni and I are both on Facebook Live, as well as if anybody has Clubhouse. It's a new app that is essentially a medium for people to have essentially live broadcast, kind of like a podcast in real person, where you can talk about different things. And so we want these media to be as interactive as possible. So if you have any questions, whether it's by Clubhouse, if you're paying attention there, or if you're watching it on Facebook Live, feel free to send us any questions. The format of the show, we want it to be interactive, but we'll each episode we'll have topics that we want to talk about. And for today's episode, we just wanted to simply introduce what our concept is, what Wellward is, what we do, and the movement that we're trying to create within healthcare. I've been practicing on my own for about 10 years now. I trained as an anesthesiologist, and then subsequently I did a pain fellowship. I went to some of the best and the brightest institutions in the country, Johns Hopkins and MD Anderson, where I felt like I was going to get the best education out there available, so I can be the best clinician for my patients. And when I started to practice what I had learned, James knows this story very well. I was just very disillusioned. I mean, I felt like I was not seeing any improvement in my patients. People were just coming back to me month after month with the same problems, and we weren't really making a dent in their condition. So I started to look outside of my basic training, or I can't call it basic; it was advanced training, and I started to challenge some of the beliefs that I had because I didn't see improvements from steroid injections. I didn't see improvements when I would send patients out for physical therapy. I would just see the same issues over and over. And so over the years, I've kind of cultivated my craft. I know that James has cultivated his craft, and we recently got together and found that each of us on our own had developed a tremendous wealth of knowledge, but when we put them together, it just took us to a whole new level. And so what we're trying to do is make what we know and how we approach issues commonplace, make that the standard as opposed to the unusual or atypical norm. So I'm going to let James, you introduce yourself and what your background is and how you got into this, and how you came to work with us at Wellward.
Of course. Well, I'm a physical therapist by training. I went to the University of Kentucky, but where I grew up in New York, I was always around people who were injured. My mom was a great example on chronic pain, and she was always going to physical therapists and chiropractors as we were growing up. And I remember playing with toys in the lobby of physical therapy offices, and always just thinking this is the coolest place ever. And that's what drove me to end up being a physical therapist. Now, a big component of what I learned over the years was that some things were just beyond what I could help. And so, what is a good clinician supposed to do when you go through that phase of your life? Well, a good one tries to get better training because maybe if you just get a little bit more training, those people you failed, you'll be able to help. And you know what? That actually did help quite a bit of people. But what started to happen was that there was just some people where I would just get right on this cusp of getting better, and I knew I was so close, but I just couldn't get them better past that mark, and it never failed me. Those were the ones who, if I just could figure out just a little bit more, they'd get better. But they ended up having surgery instead. Now, the problem that happened with that is well, surgery wasn't given as a result of some exhaustive breakdown of all the problems that are going on with the patient. It was, oh, well, this is just the obvious next step for them. And the surgical process wasn't the response that these patients wanted. They wanted to get better, and this put them down another pathway that they weren't ready to recover from. they weren't expecting to have that prolonged period of pain, and they didn't get better afterwards anyway. The same pain was often still there. So, getting frustrated by that process, I started to converse with Dr. Danesh here. After we met and started hanging out and started working out together on a fairly religious basis, we started to realize that we had a lot of very similar philosophies, but we were just coming at it from some different backgrounds. And even though I was able to help people and get some people better, there was something missing. And we also found that for Dr. Danesh, he was able to get a lot of people better in a different way, but there was always something missing. And the way that we just converse, especially during our exercise sessions together, it's, I don't know, if you were a nerd, you would love it because it's just seeing two nerds in a lab, but it's a weightlifting lab of biomechanics to try to figure things out. And that's how we started to develop a lot of philosophies that combine the best of both of our worlds to try to figure out what is going on with the patient in front of us. How can we determine the source of pain? And what are the most advanced things we could possibly do with our nerdy minds to get people better?
Yeah, what many people assume when they see us in clinic is that we don't hurt or we don't have any issues that hurt. And particularly when we're working out or exercising together, that's kind of the mainstay of our conversation is I'm hurting or I've had this chronic issue that I haven't been able to address myself. Let's put our heads together and figure this out. And we've both found that just with our own experiences of dealing with pain, dealing with injuries, preventing injuries from becoming a chronic debilitating or chronic issue, that conversation in itself is extraordinary, has been extraordinarily helpful. Um, let's give one example of one of the things that we talked about. I fell off of a horse a few years ago, and since then I had this evolving neck pain. So James and I had been talking about this issue, and so after a lot of examination, the conclusion that I had was that one of the ligaments in my neck had been stressed or strained, and that was causing excessive amount of motion at one of the segments of the neck. So generally speaking, you can think of the spine as like tripods stacked up on top of each other, where you've got two joints on the back side and a disc at the front side. And if these tripods are stacked and they're not moving excessively, then every time you look up or down, it's like they look up or down. But if they're not aligned correctly or their ligaments have gotten loose where they're sliding past each other, every time you want to look up or look down, your body first has to slide a little bit to get to the point of resistance, and then you're able to open that joint up.
Mm-hmm.
Well, in my case, the impression I had was that the ligament was loose, so it wasn't holding itself together, and so it kept sliding forward, which is going to progressively shear the disc. And over time, that's what I've seen on my X-rays is that the disc is actually starting to erode at that segment where bone is starting to develop a shelf we call osteophyte. That shelf is trying to stabilize that disc from slipping and sliding, but over time, it's not doing enough. So um, if I was my own doctor, I would do some tweaks to the ligament to try to fortify it. Since I can't put a needle into my own neck, then I talked to Dr. Escaloni and asked him, well, what can we do from a rehab perspective to stabilize this segment and get it stronger? Maybe initiate some stress on that ligament to get it stronger in the absence of getting someone to do like a regenerative injection to that. And eventually, I may very well decide to go forward and have a regenerative injection done on my neck. But my first and foremost was just simply to try to build the rehab for it. And so I'm going to let you explain what you told me when we worked out.
Oh, well, if you guys were watching his neck, this is how his neck was moving. That's that shear that he was talking about.
Like this. I don't know if you can see it or not.
Yep. It's a little bit better if it rolls up and down, almost like dominoes are supposed to roll. And because this has been going along all the time, and this guy does not stop, he's constantly working, constantly doing something. His neck had adaptations to make him even better at causing that shear force through the neck. So one of the things that we had to do is we had to actually loosen up all those joints above and below that. So it's going to allow those joints to take on some of that shear force moving back and forth. Additionally, one of the things that we started to do is make his muscles that are in between those joints, try to get those to have a little more muscle strength and bulk to them with some direct neck work. Now, the problem that happens when a lot of people do direct neck work, and especially if they've been doing this with adaptations for a while, they get really better at doing this, which makes them even worse at causing that shear force in that spot, the exact opposite of what we needed to do. So for him, we corrected his form, did some joint manipulation through here, and slowed it down with a nice isometric hold to teach his muscles in between those joints to take on that load better. And that's something that a lot of people don't take the time to do. They just go back and forth through the motion to get it over with. And it took a little bit of correcting because he figured out how to move very well in that other direction. So we had to slowly go through it. And it's something that he's going to take a little bit of cueing for, but he'll be pretty good. And eventually we'll probably have to do some dry needling around those areas so we can loosen up some of the stiffer fascia and help proliferate even better muscle growth.
Yeah, I'm going to see if I can show you what we're talking about on this anatomy app, because it's hard to conceptualize it, but it's easier to see. So, if this is the skeleton, we're talking about this area. Let me get you. We're talking about this area here. You can see how it looks like the bones are stacked up on top of each other, but the bones are actually held in place with these ligaments. You can see those ligaments there. Now, what we're thinking is that one of these segments, the ligament in between there, has been damaged. And so at that segment, it's not able to hold the integrity enough. And so over time, what I'm seeing is that it's hard to do this backwards, where this ligament right here that runs up and down the spine, that one is starting to get looser, and it's causing a shear stress on that disc and causing it to break down. Which, if I ignored it, I'd probably just have like a dull achiness in my neck for years and years and years. But if it kept going like that, it's likely going to cause some degree of stenosis and compression, and eventually I might need surgery. Our whole philosophy is that a lot of the things that people do end up getting surgery for are preventable conditions. And if we just simply treat it correctly early on, we can prevent it from evolving into something that absolutely needs surgery.
Mm-hmm.
So we want these conversations to start to happen on a larger scale. We've developed a trifecta of how we approach things, where we're looking at the tissue, the cellular components of that structure that's hurting. But we also want to look at how the body moves around that, how it's adapted to moving around that. And then finally, what are the behavioral components of it? So, like nutritionally, work-wise, if there are any repetitive behaviors that you have, exercises, all of this needs to be taken into context when we're trying to understand how to treat somebody's pain. And so, with James and I just treating my own neck, we've started some exercises. I've changed my diet to include higher amounts of collagen and vitamin C. I'm taking vitamin C and collagen supplements so that my body has the building blocks to gain from the exercises that we're stressing it with. And so over time, if we're finding that we're not getting enough traction, then at that point, I'm going to find one of my colleagues and say, hey, buddy, I know what's going on. Will you do an injection for me and put some either PRP or even just prolotherapy agents into my neck so that it gives a more robust stimulus for tissue regrowth and regeneration.
And we'll have a whole series in which we're going to be talking about what exactly prolotherapy is, what exactly PRP is, because that really is the wave of the future in orthopedics. It's the way your body can actually start to regrow tissues and create a better scar than it normally would, so that it can be as close to natural as you had originally, as was intended when you were born. without having to cut you open, without having to put fusions of large metal objects inside of you. Because, well, who would have thought that can cause some problems sometimes?
Yeah, the issue with surgery is that it's creating a stagnant place in your body. The hardware might be very strong, or whatever surgical intervention they do is going to be stronger than biology up front. But over time, your body is changing and adapting, and it has to change and adapt around that surgical fixed point. So the scars that form, the hardware that gets placed in, the damage that gets done, and simply opening things up and figuring out what to do, all of that leaves a mark that accumulates over time. So if you can fix it with biological methods where we're not invading into the body or trying to replace normal body functions or parts with mechanical parts, the better the organic solution is, the better the long-term outcome is going to be. And I see, Gloria, you said that you need to make an appointment. You know, you're welcome to pick our brains in person and ask any questions. So if anybody's listening who would like to ask any questions, by all means, please fire away. This is a good opportunity to pick two very intelligent people's brains. I'm speaking for James, not myself. But we'll have more of these opportunities. I don't want to belabor this. So every other Tuesday, we're going to have another session around this time, 5:30, 6 o'clock, depending on our schedule. We'll try to be pretty consistent with it. But we'd like this to be an engaged environment where people can ask questions. And we'll have different topics. I think next month we're going to talk about spinal stenosis. So if you know anybody that has spinal stenosis, by all means, have them queue in on Tuesday night at 5:30 p.m. because we'll talk about in more detail. Historically, spinal stenosis has been one of those conditions where, other than surgery and Band-Aid injections like epidurals, nothing really else has been offered, and that's not the case anymore. We actually have some really remarkable tools, in my opinion, Nobel Prize kind of tools that we didn't come up with. We have just used and adapted from other companies, but it really has a remarkable impact. I've had patients where they've been in a wheelchair, and frankly, they're starting now to walk and build muscles back that they had lost over years, just simply because their body is now more capable of doing the exercises or gaining something from the exercises.
Mm-hmm. Yep. I want you guys to remember this. If you've got degenerative disc disease or arthritis in your back, that doesn't equal fusion. You don't have to have a surgery.
Right. Yeah, absolutely. I've come to the conclusion that 80 to 90% of surgeries can be avoided if it's treated right. I see Fariba thanking us. She says, "Thank you both for helping me with my ongoing pain in my hips. I walk every day without any problems. I do appreciate it." And we appreciate you. It's always gratifying to see the patients who show the motivation, show the hard work that's really needed to get better and get back to normal. Well, I appreciate everybody tuning in for this. We're going to close down this broadcast. But again, if you have any questions, feel free to remark in the comment section. We'll be good about responding and getting back to you. But always, if there's an interactive question you'd like to ask on air, I welcome you and encourage you to do that. Thank you, everyone.
Thanks, guys. We'll see you soon.